Diabetes, care tasks at school. What key personnel need to know? Let's talk about some of the diabetes basics. The one thing about diabetes is it is indeed a puzzle between physical manifestations, health and learning issues, legal rights, nutrition, physical activity, and many other components. Diabetes is the body's inability to make or properly use insulin. Insulin is used to move glucose from blood into the cells for energy. If insulin isn't working, high blood glucose can result, and energy levels will be low, dehydrations or complications may occur. Type 1 diabetes is an autoimmune disorder where insulin producing cells are destroyed, requiring daily insulin replacement. Age of onset is usually childhood, potentially young adult, and it is the most common type of diabetes in children and adolescents. The symptoms include increased urination, tiredness, weight loss, increased thirst, hunger, dry skin, blurred vision, and while the cause is uncertain, both genetic and environmental factors are likely at play. Diabetes does not go away, but it can indeed be managed, and this requires managing blood glucose. Things like insulin medication and physical activity can make blood glucose go down, while food intake makes blood glucose go up. Management can usually be handled either all or in part by the diabetic themselves. And some school students will need staff to perform and assist with other routine diabetes care. In the case of emergency, all students with diabetes will need help in the event of an emergency situation. A school nurse is most appropriate to coordinate that diabetes care, supervise the care, direct care when available, and communicate about health concerns with parents, guardians, or the healthcare team. However, a nurse is not always available, so non-medical school staff must also be trained as well for both routine and emergency care, including insulin and glucagon administration. So diabetes management plan, this is the basis for all school-based diabetes care plans, developed by the student's personal health care team and guardian, signed by a member of the student's personal health care team. It's also individualized, implemented collaboratively by the school diabetes team along with the school nurse, student, parent, guardian, and other school personnel. Managing hypoglycemia is a vital piece of this comprehensive plan. Let's talk about a little bit of vocabulary. Glucose is a simple sugar found in blood that fuels all body cells need to function. Hypoglycemia is low level of glucose in the blood. Quick-acting glucose, which are sources of simple sugars that raise blood pressure or raise blood glucose levels, like juice, regular soda, glucose tabs or gel, hard candy. There are also glucose tablets or gel, which is a special product that delivers a pre-measured amount of pure glucose. They are fast-acting and are meant to counteract hypoglycemia. A carbohydrate is a source of energy for the body, which raises blood glucose levels. Glucagon is a hormone given by injection that raises the level of glucose in the blood. Hypoglycemia or low glucose sugar, the onset can be very sudden, must be treated immediately, may progress to unconsciousness if not treated, can result in brain damage or death. DMMP should specify signs and actions and steps at each level of severity from mild to severe. Hypoglycemia complications can include the early recognition and intervention that can prevent an emergency. The greatest immediate danger, it's not always preventable and impairs cognitive and motor functioning. Hypoglycemia has possible causes: too much insulin, too little food or delayed meal or snack, extra or unanticipated physical activity, illness, medications, or even stress. Possible signs and symptoms are included here as well. Mild to moderate hyperglycemia, what do you do? Well, you must intervene promptly following the diabetes management plan. Check blood glucose if meter is available. If no meter is available, treat immediately on the spot. Never send a student with suspected low blood glucose anywhere alone. When in doubt, always treat. If untreated, it may progress to more serious events. Consider the Rule of 15. The Rule of 15 is a general set of guidelines. Have the student eat or drink fast-acting carbs, about 15 grams. Check blood glucose 10 to 15 minutes after treatment and repeat the treatment if blood glucose levels remains low or if symptoms persist. If they continue, call parent or guardian per the plan. Treatment for lows would be 15 grams of carbohydrates. For example, 4 ounces of fruit juice, 1 tube of glucose gel, 1 or 2 tablespoons of honey, or any of the others listed. Severe hypoglycemia symptoms may include convulsions or seizures, loss of consciousness, and inability to swallow. Severe hypoglycemia, although it is rare but life-threatening if not treated promptly. Place student on his or her side, lift chin to keep airway open, inject glucagon per student's plan. Never give food or put anything in the student's mouth. Call 911, then the parent or guardian. Student should respond in 10 to 20 minutes. Remain with the student until help arrives. Hypoglycemia has preventative steps. Physical activity, insulin, eating, checking blood glucose per the schedule. Keep a quick-acting sugar source with the student always. Treat any onset of symptoms, ensure reliable insulin dosing per the plan, and ensure that it matches the food eaten. Watch picky eaters and provide nutritional information to parent and guardian, as there may be after-meal dosing prescribed by the plan. Additional prevention steps is consult with parent or guardian or school nurse when a snack meal or physical activity times must be changed. Monitor blood glucose variations on gym days. An extra snack may be required. A student should never be unattended when a low blood glucose is suspected. Maintain adult supervision. For teachers, there is some other information. Students with hypoglycemia or hyperglycemia often do not concentrate well. Students should have an adequate time for taking medication, checking blood glucose, and eating. During academic testing, provide accommodations per the 504 or IEP plan. This may include checking blood glucose before and during testing, access to food, drink, or restroom. If a serious high or low glucose episode occurs, students should be excused with an opportunity for retake. The phrase, make the right choice the easy choice, applies here as well. Eliminate barriers to diabetes management. Become familiar with and follow the student's plans. Eliminate barriers to snacking, blood glucose checks, access to water in the bathroom, and insulin administration. Avoid judgments based on the individual blood glucose readings, and communicate with parent, guardian, and school nurse. Timely glucagon administration, when indicated, is a vital piece of a comprehensive plan. What is glucagon? Naturally occurring hormone made in the pancreas. It's a life-saving injectable hormone as well, glucagon or glucagen, that raises blood glucose level by stimulating the liver to release stored glucose. It's also a treatment for severe hypoglycemia. It is life-saving and cannot harm a student, and they cannot overdose. A glucagon or glucagen storage kit looks as follows. In the place would be designated by the plan, and make sure it's accessible to school personnel. It must be stored at room temperature, and the expiration date must be monitored. After mixing, dispose of any unused portions within the hour. 1 milligram of freeze-dried glucagon in the vial. 1 milliliter of water for reconstitution should be in the syringe and combined immediately before use. When to give glucagon or glucagen? If authorized by the student's plan, and if student exhibits unconsciousness, unresponsiveness, convulsions, or inability to safely eat or drink. The procedure is to act immediately. If possible, check blood glucose. Don't delay. If in doubt, always treat. Position a student safely on the side for comfort and protection from injury. A school nurse or trained personnel notified to give glucagon in accordance with the plan or emergency care plan. Call 911, a parent or guardian, school nurse as per the plan or emergency care plan. For preparation and use of this tool, flip the cap off the glass vial containing the dry powder. Remove the cap from the syringe. Put on gloves if available. Inject the entire fluid into the syringe into the bottle containing the powder. Shake gently or roll to mix until all powder is dissolved and the solution is clear. For dosing and drawing out, inspect the solution that should be clear and colorless. Draw prescribed amount from the glucagon back into the syringe. When injecting, clean the site if possible. Inject at a 90-degree angle into the tissue under cleansed area. You may administer through clothing as necessary into buttocks, thigh, or arm. After injecting, it may take 10 to 20 minutes for the student to regain consciousness. Check the blood glucose. Give sips of fruit juice or regular soda once a student is awake and able to drink. Advance diet as tolerated. Document per the plan, and do not recap the syringe. Discard sharp in an appropriate container. The time to complete recovery from a severe hypoglycemic episode varies according to how low the blood glucose level was and for how long prior to treatment. Some signs and symptoms, such as headache, may persist for several hours, although blood glucose level is satisfactory. Continued monitoring is important. Student may need to be transported via EMS or go home with a parent or guardian. Do not be surprised if the student does not remember being unconscious, incoherent, or has a headache. Do not be surprised if blood glucose becomes very high, over 200. And don't be surprised if nausea or vomiting may occur. Managing hypoglycemia is again a vital piece of the comprehensive plan for student learning. We have, instead of hypoglycemia, which is low, hyperglycemia is too high a level of glucose in the blood. Ketones, or ketone bodies, are chemicals that the body makes when there is not enough insulin in the blood and the body must break down fat for its energy. So diabetic ketosis, an acute metabolic complication of diabetes characterized by excess acid in the blood, which can be life-threatening. Ketone testing, a procedure for measuring the level of ketones in the urine or blood. Glucose, a simple sugar found in blood that fuels all body cells need to function. Hyperglycemia, or high glucose, usually slow to develop to severe levels, more rapid with pump failure or malfunction, illness or infection. It can mimic flu-like symptoms. The greatest danger may lead to diabetic ketoacidosis if not treated. The plan will specify signs and action steps at each level of severity from mild to severe. Below are some possible signs and symptoms of hyperglycemia. Some of the risks and complications for hyperglycemia, which if untreated can lead to DKA and potentially to coma and death, mainly in type 1. It interferes with a student's ability to learn and participate. Serious long-term complications can develop when glucose levels remain above the targeted range over time or are recurring. What to do? The goal is to lower blood glucose to a target range. The action steps, following the plan, of course: verify the blood glucose check. Check ketones. Allow free use of bathroom and access to water. Administer insulin. Recheck blood glucose. Call parent or guardian. Note any patterns. Communicate with school nurse and or parent guardian. Some of the possible causes may be late, missed, or too little insulin, food intake that exceeds insulin coverage, decreased physical activity, expired or improperly stored insulin, illness, injury, stress, other hormones or medications, hormone fluctuations, including menstrual periods, any combination of the above. Prevention. The biggest step to prevention is timing, accuracy, and changes. Timing is very important. Stick to the schedules, mealtime and insulin administration, and physical activity. Accuracy is very important. Insulin dose, monitoring, and the amount and type of food eaten is important for prevention of hyperglycemia. Changes should only be made after consultation with the parent, guardian, or school nurse. Snacks, meals, or insulin or physical activity times or amounts, if changed. The information teachers need would include students with hyper or hypoglycemia often do not concentrate well. They should have adequate time for taking medication, checking blood glucose levels, and eating. During the academic testing, provide accommodations per the 504 and IEP. Again, make the right choice the easy choice. Eliminate barriers to diabetes management. Beyond becoming familiar with the plan, eliminate the barriers to snacking, checks, access to water, and insulin. Avoid good or bad judgments based on individual blood glucose readings and always communicate with parents and or school nurse.